today I'm going to walk you through how a substance use treatment provider can use PlanStreet to support clients engage in medication-assisted treatment. So let's dive in. Tom Topgun has just entered treatment. So we can begin by going over to the Forms tab and documenting his intake details and current medications. We'll have a drop-down list, which is filled with some of the different forms that you have within your organization. I can just start typing in the form that I'm looking for. I'm going to use the intake form for this particular demo. And then you'll notice here at the bottom, we can capture a lot of different information. Everything within PlanStreet is highly configurable, so we can adjust these drop-downs and fields to ensure that we're capturing all of the information that you might need to capture. We can also attach files here at the bottom. We can begin working on this form, save it to continue working later. We can save it and submit it to the case file once it's been completed. And at the very top, you'll notice we have another option. I can actually email or text forms to the client. This allows them to fill out with their portion. They can sign for it if they need to and send it right back to us in PlanStreet. So a form like this would allow us to capture information in terms of the medication they're already taking, any allergies, their prescribing provider, and then what I'll do is I'll just save this to complete later. And then I'll also attach a HIPAA form to show you what the signature line looks like. See, I can just add to the signature and then I can save. Okay, so next I'm going to move over to the Programs tab. So you can see here in just a moment that we have a customized treatment plan for Tom with MAT specific goals. So within these different programs, we can do things like track prescriptions, coordinate therapy appointments, set reminders for substance screenings, or even set up routine peer support meetings. So what I'll do is I'll come over here and select the individual counseling activity. I'll come over here to edit so I can make changes, so I can assign my caseworkers, I can add or remove providers as I would like, and I can also link this activity of individual counseling to other activities as well. So if I want to link individual counseling with, say, his medication and the peer support, that's going to give us a much better idea of how these different programs and activities work together in concert to support Tom as best as possible. We also have a checklist item here, so as I complete certain tasks, I can cross them off. And then I can add case notes right here. Those get logged and time-stamped within the system. I can track everything right here within PlanStreet. And if I need to make a referral, let's say we need to make a referral for behavioral health. He needs another provider for something, let's say. I can come here, go to add, go to the drop down, and then just select the provider that I want to make that referral to, and then hit save. And I can make multiple referrals, and we can just add to that drop down list as you create new partnerships. We can remove providers if you decide not to continue with that particular organization or provider for some reason. And then to reduce barriers to care, we can also manage inventory items directly within PlanStreet. So let's say a client needs a cab voucher to get to their appointment, or we want to provide them with a naloxone kit to help prevent a fatal overdose. I'll just come over here to add, and then we would have a list of the different items that you have available to disperse to your clients. So we'll have a cab voucher, and then I will add, and maybe I'm going to provide them with 4 Narcans and 4 cab vouchers. And then I come up here and hit save. All of this gets logged within the system. We can keep track of who's getting what, for what purpose, who's making that disbursement. So it's really easy to keep track of how much inventory we have on hand and which clients are benefiting from them. So the service is recorded in real time, helping your team ensure follow through, avoid duplication, and track resource usage accurately. So when we're doing each visit or touch point with the client, we can go over and do the notes. We can also monitor their progress. We can come up here to the top if we need to adjust the priority level, indicate whether there's a delay, or if there's an issue, I can even flag this or mark the activity as in progress or complete. We could also run reports. So when we've worked with this client, we can go into the dashboard later on and we can generate those reports to check their adherence to treatment over time or even referrals by outcome. PlanStreet makes it easier for you and your team to break down barriers, stay organized, and get folks connected to the care and support they need, because every step matters when you're helping people heal. Thanks for joining us for this quick look at how PlanStreet can support your MAT program. Stay tuned for more walkthroughs and feature highlights, and we'll see you next time.